Hey guys, Dr. Ash here coming to you with a quick video in regards to elimination, i.e. the basics. So first of all, let's talk about urinary considerations. This is going to be the first thing we talk about, really quick and dirty. So here we go. For our genetic male population, I'm not sure if this thing started from the beginning or not. So anyways, again, Dr. Ash here for Elimination the Basics. So for our urinary considerations, our genetic males tend to urinate standing up. It just is what it is. So a lot of times our patients who are bedridden or maybe on bed rest and our male patients, they tend to want to stand. They have issues with urinary retention unless you can get them to stand. And oftentimes we all kind of know it's mind over matter, but it's just their routine. And so oftentimes you will find that if you can just get them to dangle or even get them up to a somewhat standing position, that may help them urinate. Females, our biggest thing is urinary tract infections because we have a whole lot of holes that are really close together, right? We've got the urethra, we've got the vagina, and then we've got the anus, all relatively within a short period of time, space from each other. And the fact that our urinary tract is much smaller than males puts us more at risk for UTIs and bladder infections. And so our two biggest ones here are going to be make sure that you drink plenty of fluid, enough to pass either pale yellow or clear urine, and then also wiping front to back for hygiene purposes. And one that people don't really think about is to make sure that you avoid frequent bubble baths or very long bubble baths, because again, sitting in that water exposes the urinary tract to bacteria. Patients with oliguria, which is also known as low urine output, the very first thing you want to do before you jump to any other conclusions is you want to make sure that they're not retaining urine. So that means we need to assess for bladder distension. Okay, so assess for bladder distension because it may not be that they're not producing urine. It may be that they cannot expel their urine. So please be careful of that. Last thing about urination before we move on to stooling or defecation is if you have a catheter, remember a urinary catheter must be placed sterilely. So sterile gloves, sterilize the peri area in order to insert the urinary catheter. The other thing with urine catheters is urinary tract infections or catheter associated UTIs, also known as CAUTIs, CAUTI_s. And this is a couple of different things that you want to do. Number one, you want to make sure the tubing is straight. You want to make sure that the urinary collection bag is below the level of the bladder. No loops in the tubing. You want to make sure the bag does not touch the floor. And then the other, probably the most important one, is that you want to maintain a closed system. That means we're not connecting and disconnecting over and over and over again from the urinary catheter itself that goes into the patient to the bag. So we want to maintain that closed system. Next, we'll move on to defecation or stooling or pooping, whichever the case may be. You want to make sure that if you have a patient in the bed in the hospital, they may have difficulty going on a bedpan. I don't know if you've ever tried it, but not a pleasant experience. So I oftentimes want to mimic a sitting position, and I would do that by raising the head of the bed. Help them go just a little bit easier. Our two main things when it comes to bowel movements is constipation and diarrhea. So constipation most often caused by patients who are immobile, so they're not up and moving around. It can also be caused by dehydration or not enough fluid going around in the body. It can also be from opioids, but our two kind of number one reasons that people in the hospital get constipated, number one, they're not up and moving, and number two, they're not hydrated enough. Diarrhea is the opposite end. It just kind of flows. And of course, when we have diarrhea, our biggest issue is fluid and electrolytes. Now, that prompts a whole nother conversation, but that is not for fundamentals. So hold on to that concept for future reference, i.e., maybe your next semester when we talk about fluid and electrolytes. Colostomies. Now, colostomies is a surgical opening in the colon. It is a little bit further down the GI tract, i.e. the colon. And so we find oftentimes that that stool is a little more formed, looks more like a regular bowel movement versus the ileostomy, which is around the ileum, which is much higher in the digestive tract, really you don't have a whole lot of time to digest and do all that fun stuff. So oftentimes, well, not oftentimes, all the time, that stool is liquid. Okay, so this is very fundamental. Very liquid in the ileostomy versus the colostomy is going to have a little bit more formed stool. The other thing with the ileostomy and the colostomy, never, ever, ever should you see blood. So blood is a cause for major concern, and you need to call the doctor. And that's it for elimination. How easy was that? So I will see you guys in the next recording.